Do you play a sport that requires high-speed running or leg dexterity? If so, watch this video to learn about how to help prevent a common sports-related injury through a simple movement. The hamstring muscle injury is one of the most common muscle injuries across a range of many sports such as soccer, American football, dancing, track and field, rugby, and cricket. It can be a devastating injury leading to debilitating pain, poor performance, and early retirement. The hamstring muscle group is a group of 3 long muscles that run across the back of your thigh, starting from your hip to just below your knee. This muscle group helps you walk, run, sprint, jump, bend your knees, and extend your leg. The hamstring muscle group also helps to provide dynamic stability to the knee joint and helps keep the knee joint integrity. It is proposed that the hamstring muscle injuries more commonly happen during the late swing phase of the running cycle. Many researchers hold the view that this phase of the running cycle is the most hazardous for the hamstrings. During this phase, the hamstrings control the rapid leg rotation. To control this rapid leg rotation, the hamstrings contract forcefully while also reaching close to maximum length. Therefore, the hamstrings are more likely to get injured during this phase. Also, once you have a hamstring injury, you are more likely to injure it again while playing. Now, let's show you a movement you can do without any special equipment that will help make your hamstrings injury resistant. To perform this movement, hold your trunk upright and rigid. Keep your feet in contact with the ground through the entire movement. You may have another person hold your ankles to the ground, or you may use bars or weight with cushion. Have your hands in front of you to buffer the fall. For beginners, start closer to a wall or a bench and slowly step back as you feel stronger and more confident with the movement. Repeat until failure and perform 3 to 5 times a week for at least several months to see tangible improvements in hamstring eccentric strength. Now let's briefly look at some studies that have tested this exercise. Study number 1 found an increase in eccentric torque of hamstrings after 10 weeks of training. Study number 2 was an RCT done in more than 500 soccer players, and they found significant reduction of hamstring injuries in the intervention group. Study number 3 was a cluster randomized controlled trial, and it showed prevention of recurrent hamstring injuries by 86%. This 4th study was a carefully conducted and good quality meta-analysis of 4 RCTs in 1 cohort study. The authors found 51% reduction in hamstring injury rates in the long term compared to control. Compliance and adherence is important for getting results. If you have any orthopedic problems or other health issues, consult with your physician or physiotherapist before doing this movement at home.